Hello, I'm Dr. James Newman, and today we're going to be talking about rhinoplasty or nasal surgery. Many people hear about nasal surgery or they see a family member or somebody in the media who has a bandage on their nose and oftentimes wonder, well, what type of procedure was performed. Rhinoplasty refers to a procedure where we're basically reshaping the nose. In addition, we oftentimes correct functional problems of the breathing system to allow patients to breathe better not only during the day but also at nighttime. So rhinoplasty is a surgical procedure performed usually within about 1 to 2 hours in an accredited operating facility here at Premier Plastic Surgery. There are many indications for performing a rhinoplasty. The most common indications that we see in our practice here are typically patients who may come in with a hereditary condition where their nose has a bump on the nose. Maybe they have a widened nasal tip, perhaps even a hanging tip of the nose, and also for a crookedness of the nose. Now, many of these things can be inherited from a family member. Some of them can be acquired through sports injuries or accidents, motor vehicle accidents, although the incidence of trauma to the nose has decreased since airbags have been employed for the past 15 years. So oftentimes patients will come in with either one of those conditions or a combination of those conditions. When we see a patient here, we will typically take a look at the nose, not only from the profile to see the shape of the nose, but we'll also look at the internal anatomy. And that's what I'm trying to show on this particular model, is this half-face model that when we look into the nose, there is a dividing wall between the left and right part of the nose known as the septum. And then beyond the septum, where you see these little colored objects, these are the sinuses of the nose. So most people, think about their sinuses when they have a cold because of pressure sensation, or pain. And these are basically air-filled spaces that equalize with the surrounding pressure. And when there's any type of blockage from the nose, the pressure between the sinuses and the surrounding air is different, and that can elicit the feeling of pressure or pain. So one of the things that we always do is a complete and thorough nasal examination to check the condition of the septum along with the little structures known as the turbinates of the nose. These are structures that are 3 in nature on each side of the nose, and they help produce humidity for the inside of the nose. They also function for the sense of smell in the top part of the nose. So it's very important that we assess all those types of factors. So if a patient's coming in and they're concerned about a bump on their nose or a hanging tip of their nose, we need to look on the inside and make sure that everything is clear. One of the advantages that we have is that we do both functional as well as cosmetic surgery. I am a double board certified facial plastic surgeon as well as an ENT trained surgeon, meaning that I have specific training related to the functional aspects of the nose. So when we perform a procedure for a patient, if it's purely cosmetic, we are typically working on the outer part of the nose. Most of those incisions are created from the inside of the nose, and occasionally we may need to make a small incision on the base of the nose known as the columella. And those are typically reserved for cases that are more complicated or somebody who might have a very severely twisted nose, or maybe they've had nasal surgery in the past. And so one of the unique things about our practice is that we take care of patients who have never had nasal surgery before, but we also have about 20% of our patients who come to us who have had surgery done sometime in the past. And that's known as revision rhinoplasty. Revision rhinoplasty is a more complicated type of surgical endeavor because there's scar tissue, and sometimes people might have some nasal cartilage that might be missing or even a crack to their nasal bone.